There is growing pressure on President Trump to take real action on vaping, e-cigarettes, and especially their use among young people. But there's also a big debate about what should or should not be done. That played out in real time at the White House in front of the president today. As William Brangham reports, this comes as more individuals have been sickened by vaping associated injuries. Nearly 2,300 people have lung injuries, and vaping has been associated with at least 47 deaths.
Today's White House meeting reflected the wider national debate around vaping, whether the federal government should ban flavored e-cigarettes or set age limits.
We've got almost 6 million kids addicted to nicotine, and they're getting addicted to nicotine because of flavors.
For his part, the president didn't commit to a specific ban or plan, but at times he seemed open to the argument that any kind of ban on flavored cartridges would not be effective.
You watch Prohibition, you look at, with the alcohol, you look at cigarettes, you look at all. If you don't give it to them, it's going to come here illegally, okay? Right. They're going to make it. But instead of Reynolds or Juul or, legitimate companies, good companies making something that's safe, they're going to be selling stuff on a street corner that could be horrible.
The president first pledged federal action back in September when people started getting ill from vaping.
But we can't allow people to get sick, and we can't have our youth be so affected.
But since then, no significant action has been taken. Several published reports said pressures from lobbyists, vaping supporters, and political advisors stopped the president from issuing any bans. Many parents and public health officials worry that too many young people are still vaping. A recent survey found more than 5 million kids used e-cigarettes during a single month earlier this year, including more than 1 out of 4 high schoolers and 11% of middle school students. Too many young adults have also ended up in the hospital, including a 16-year-old male who received a double lung transplant in Detroit last week.
This young patient would have died. There is no doubt about it.
Researchers are still trying to understand the causes behind those illnesses. The injuries are believed to be largely caused by non-commercial black market vaping products laced with chemical agents like THC or vitamin E acetate. Those appear to be causing lung injuries similar to chemical burns. And many states are taking their own steps as well. California and New York have filed lawsuits against the biggest e-cigarette manufacturer, Juul Labs, and several others are passing their own bans of flavored e-cigarettes. Matthew Myers is the president of the Campaign for Tobacco-Free Kids, and he was in today's White House meeting. Welcome back to the NewsHour.
Thanks for having me.
Help me understand, what did you make of the debate that happened in the White House today? You sat there right opposite the president. Do you think after seeing this conversation unfold that we are any closer to where you would like us to be?
Well, my hope is that we are. One of the things I thought was remarkable today was that all of the major physician groups in the United States, as well as public health groups, were in the room, and every one of them said the same thing. If we're going to reverse the youth e-cigarette epidemic, we have to get rid of the flavors that have fueled it.
And that really, to you, is issue number one, hands down.
Anything else we do won't work unless we get rid of the flavors. What we have seen is that 97% of all kids who use e-cigarettes use a flavored product. 70% of them say they use the product precisely because of the flavors. If you have something out there that kids will want to get, they'll find a way to do it.
What do you make of the president's argument, and he brought up something that many people bring up, that if you ban flavored cartridges, the kids love those flavors. They want the sweet, they want the colorful, that they will get them on the black market, and then you've lost the ability to really regulate and know what they're purchasing.
Well, I think there's a couple of responses to it. First of all, the presence of the flavors is what has led 1.5 million new kids to become addicted each year. If we do nothing else but stop that on-ramp, we will do something very important.
Is the evidence crystal clear that it's the flavors that are getting kids?
It is absolutely crystal clear that it is the flavors that attract kids, and then it's the high level of nicotine in them that are addicting the kids. It's the 1-2 punch. If we get rid of the flavors, though, kids will not try these products. The second thing that I think is very important to understand is that the tobacco industry always argues every time we want to do anything that counterfeit cigarettes, counterfeit products will undermine. The public health and the government response is not to pass good laws, it's to enforce the laws effectively. I have no doubt that if we eliminate flavors, we will see millions fewer kids become addicted, and we'll see many of the kids who are currently addicted try to quit.
Help me understand where kids today are getting these. What are they smoking? Where are they getting them? How is that happening?
There are a lot of myths out there. A good number of kids do get them through social sources, older kids who buy them for them. But what we also found is that a large percentage of kids who use Juul, the #1 brand, get them from vape shops. And
These are stores that are dedicated to selling nothing but e-cigarette
That's exactly
products.
right. That's exactly right. There's an image out there that kids aren't allowed in those stores. They are, and they have a track record of selling to kids that's frankly worse than other stores. So if we're going to solve this problem, what we have to do is make sure that the rules apply to all stores.
The president back in September came out and said this was in response to those illnesses, which I get it that federal authorities are still trying to figure out what's driving those illnesses. But the president said, let's ban these flavored vape products. He said a lot of things that you wanted him to say, but yet here we are several months later, we haven't seen that action. Why do you think, what's the hiccup?
Well, unfortunately, the e-cigarette industry, which has done everything they can to avoid responsible regulation, have vigorously opposed his proposal as well. They have claimed that he will lose votes on it. They have claimed that it will impact adult tobacco users. The facts don't support that. 77% of all Americans, including conservative Republicans, support banning flavors in order to reduce the number of kids in our country who become addicted. The other critical fact is the meteoric rise in youth use as a result of the flavors has not been accompanied by an increase in adult use. Today, there are fewer adults using e-cigarettes than there were 4 years ago. If we get rid of the flavors, we're going to stop the on-ramp of kids, and we can begin to address what we really need to do, and that is how to help adult smokers quit.
Because that is the argument that the industry and many supporters of vaping argue, which is this is a product principally that is supposed to help people who are smoking tobacco cigarettes get off of that.
Unfortunately, the rhetoric doesn't match the facts. The entire growth in the market over the last 4 years is kids, 100% increase. We have seen high school use double in the last 2 years, middle school use triple in the last 2 years. We have 1 million kids who are using these products addicted on a daily use. It is really a crisis. And unless we stop that number from growing, we're going to pay for this for decades to come.
Matthew Myers of the Campaign for Tobacco-Free Kids, thank you very much.
Thanks for having me.